When the blood is pumping through the heart, it really is the equivalent of two different systems. Because the right side of your heart is all about the oxygen-poor blood, while the left side of your heart is all about the oxygen-rich part of the blood. So what they've done is they've divided into two different pathways. You have the pulmonary circuit. Now, the pulmonary circuit is taking the blood from the heart, which is the right side, out to the lungs, and then back to the heart, left side. That's one circuit. The other circuit is the systemic circuit. Systemic is going from the left side, left ventricle, to the entire body, and then back up to the right atrium. So you're looking at taking this blood and it being two very distinct pathways, different circuits. So here you can kind of look at it and see how we do this. You have the right side of the heart is going to be all the blue part there. Blue being oxygen poor. You'll notice then that we have two different types of circuits. This one is going to be the pulmonary circuit, the lungs. The lungs and the pulmonary circuit are going to be from the right ventricle, pumping out to the lungs, back into the left atrium. The other one is this circuit from top to bottom. That's the systemic, the entire body basically. That's going from the left ventricle, the whole body, back to the right atrium. So two distinct circuits, and that's how the blood flow through the heart works. You'll notice the picture up top, the kind of enlarged heart here. You'll see it comes back in the vena cava, goes to the right atrium, down to the right ventricle, out to the pulmonary valves. That's going out to the pulmonary trunk, pulmonary arteries, lungs. Then it comes back in red, comes back into the left atrium, down to the left ventricle. Then it's heading out the aortic valve, out to the aorta, and the rest of the body, systemic. So as this pathway follows through the heart, you'll notice that, as I mentioned before in a previous video, the pulmonary circuit is low pressure. That's because it's just going from the right ventricle just next door to the lungs. Right ventricle, lungs, and back. That's it. It doesn't have to fight too much as far as gravity. It doesn't go long distances. Everything is short and contained right in the thoracic cavity. But even though that's low pressure, where the systemic is going to be high pressure, you must have equal volumes. You have to pump the same amount of blood through the right side as you're pumping through the left side. By keeping equal volumes of blood, you make sure that there's not a backup somewhere. Because if you had one side pumping more blood than the other side, eventually there'd be a backup in either the systemic or pulmonary circuits. Because it wouldn't be an equal give to one circuit, pull from the other circuit. Give to one, pull from the other. They have to be equal going back and forth. So each ventricular contraction, right and left side, are pumping equal amounts of blood from the right to the pulmonary circuit, from the left to the systemic circuit. But now that systemic circuit is going to be a higher pressure system. So whenever you hear about blood pressure, maybe 120 over 80 millimeters of mercury, that blood pressure is the pressure in the systemic circuit. That's because the systemic circuit pumps the entire body. So therefore, that means that there's more resistance and more pressure in those vessels. So overall, this whole system has to reflect that. The anatomy must show the difference of the systemic being high pressure, the pulmonary being low pressure. And that's why I've mentioned in the last video, the left ventricle has a thicker muscular wall, while the right ventricle is going to have a thinner muscular wall. Systemic, left ventricle has to be stronger. Pulmonary, right ventricle still has strength, but it doesn't need to generate as much force. So looking at an actual heart, you'd be able to judge right versus left based on the thickness of the ventricular wall. Now, the wall, so outside walls here and here. You cannot use the septum in the middle because, well, which one does that count for? so it has to be the outside walls. But the anatomy reflects the physiology. More muscle, more pressure. So those valves we've talked about before. There's 4 valves in the heart. We have the tricuspid and bicuspid, or the right and left AV valves. And then we have the aortic and the pulmonary valves, or the semilunar valves. Looking at this is an anterior view in the front here, anterior, posterior in the back here. But we're looking from a superior view coming down. So what you'll notice is looking at the tricuspid valve, you'll see there are 3 flaps, hence tri. While the bicuspid only has 2 flaps, hence bicuspid. So what's looking at here is they're all closed. That means the blood's not really flowing anywhere. You can see the 2 different semilunar valves. Those are the pulmonary and aortic semilunar valves. So you can kind of get the orientation how the chambers are a little more posterior, while the vessels leaving, pulmonary trunk and aorta, a little more anterior. This is going to be a view of a real heart now. You'll notice how the valves of the tri and bicuspid aren't closed, because they only close if there is pressure in the ventricles pushing them closed. But look at the semilunar. The semilunar valves are naturally closed. They have 3 different pouches in each one. That's because as the blood flows past, when it starts to come back down, those pouches catch the blood, closing the valves. And remember, we mentioned in the last video how the bi and tricuspid valves had these chordae tennae anchored to the papillary muscles. Look at these strings. They're all anchoring the valve. So again, as the ventricle contracts and generates pressure, it tries to push the blood up. The valve catches it, and the chordae tennae prevent it from blowing back open. So it's opened, blood catches, and closes it. And just to get a more visualization of how these different AV valves work, so the bicuspid and tricuspid. When the blood is flowing from the atria down to the ventricle, the vast majority of that is passive. The blood just flows on through, no problem. The valves are open. But once that ventricle starts to contract, you'll notice the blood is then being pushed back upwards. Well, you don't want to go backwards. So the way this works is these strings, these chordae tennae, you can see them in the lower picture. They're being held in place. So that valve being opened, but the minute pressure starts pushing blood in, they collapse back closed and are held in place closed by the chordae tennae and those papillary muscles, preventing backflow of blood. But now the semilunar valves, the pulmonary and the aortic, didn't mention any chordae tennae there. So how do they prevent backflow? Because all 4 valves are preventing backflow. Well, when the ventricle contracts, it pushes blood through. That pushes the cusps open. So blood just flows on through, no problem. But now, once the ventricle is done contracting and it starts to open back up, there's no more pressure pushing the blood up. So the blood wants to flow back down. But what happens is the blood is caught in these cusps. And because the cusps come close and hold each other, the blood can't go backwards. It prevents it from going back into the actual ventricles themselves. So both the semilunar valves, which we're seeing here, these cusps help hold it, and back to the last one we looked at, the AV valves, tri and bicuspid, with their pouches and the chordae tennae holding, they're all preventing backflow of blood back to where it came from. Blood can only go in one direction, and that's because of these valves. So if we're looking at how the valves look when the atria to ventricle has blood flow occurring. So atria, past leaf ventricles, blood flow goes. From the superior view, you'll notice that both of the AV valves, bicuspid and tricuspid, are opened. Blood is passively flowing down into the ventricles. But notice the semilunars. The aortic and the pulmonary semilunar, they're closed. You're trying to prevent the backflow of blood going into the ventricles. But now let's switch it up. Ventricles are having blood go into the vessels. So this is the aorta and the pulmonary trunk. Notice that the tricuspid and bicuspid, these AV valves, are closed. That's because when blood is flowing from the ventricles into the vessels, the ventricles are squeezing, they're generating pressure, which closes those AV valves. But the semilunar are opened. The blood's flowing from the left ventricle up through the aortic semilunar. The blood's flowing from the right ventricle up through the pulmonary semilunar. So blood is flowing out at that point. Looking at those four valves in conjunction with the atrium, the ventricles, as well as the vessels, making sure that blood is going in one direction and one direction only. What you don't want is blood to ever flow backwards in that circulatory system. It better always flow forwards, going through from the right atria to the right ventricle and out, left atria, left ventricle, and out. So always constant forward progression of the blood.